Welcome to Health Professional Radio. I'm your host, Neil Howard. Glad that you could join us on the program today. Our guest is Dr. Neelima Dendelluri. She's here to talk with us about some of the latest news that came from the San Antonio Breast Cancer Symposium. She's the Associate Chair of Breast Cancer Research at the U.S. Oncology Network. Thank you for joining us today, Dr. Dendelluri.
Thank you for having me.
Beyond being the Associate Chair of Breast Cancer Research there at the Oncology Network, what led you to breast cancer research?
So interestingly, I grew up in a village in India until I was 6 or 7 and used to go back every summer and shadowed my grandfather, who was a community doctor. And that really awakened my eyes at a very early age to the health inequities with how my family lived with the surrounding village. And then I went to medical school and college in Louisiana, also a place where I think there were a lot of health inequities and a lot of women's health issues that needed to be addressed. And I had a wonderful mentor at LSU that opened my eyes to breast cancer research when I was 19, 20. So it's become a long passion for me to incorporate women's health research and make sure that everyone has the great health care, no matter where they live.
I did mention the San Antonio Breast Cancer Symposium. What did you see coming out of the symposium as eye-opening or maybe as potential game changers in the breast cancer research arena?
So interestingly, we are increasingly dividing breast cancer into subtypes: HER2, triple negative, estrogen receptor positive, are buzzwords that we see. But even within those categories, we're subtyping them further. For example, triple negative breast cancer has always been looked at as a tough disease to treat, but now we've made some advances saying these are the people that need more chemotherapy. This population is more likely than other breast cancer subtypes to be associated with a genetically associated cancer. So there are a class of drugs, for example, called PARP inhibitors, which seem to improve outcomes for women who develop breast cancer as a result of having inherited a gene from their mom or dad. So I would say more targeted therapy, more personalized therapy. Additionally, there are new drugs being developed for each subtype of breast cancer. But what really struck me, to be honest, with the San Antonio is that some of the old lessons are being revisited. For example, women with estrogen receptor positive breast cancer, which means that their breast cancer feeds off of estrogen or progesterone, and that's a vast majority of women diagnosed with breast cancer. It's really important that we support them for their anti-estrogen therapy. And I really like that things like acupuncture, yoga were looked at as possible ways to help these women tolerate the side effects of these anti-estrogen therapies.
Would you say that that was the most significant thing that struck you at the symposium?
I think that the overall focus on wellness was very striking to me. And the fact that while we want people to stay on these drugs because it is very important to reduce their risk of cancer coming back, or once that they are on cancer therapy, we want to reduce the growth if it's a chronic disease. We also want to find a way to support them to tolerate that better. And also, as I always like to say, one other thing that struck me is that wellness in general is very important for prevention. For example, postmenopausal women that lost 5% of their body weight had a significant reduction in their breast cancer, in developing breast cancer. The other thing that is interesting, going back to overall supporting women, is one thing that comes up with a lot of young women that I have the privilege to see is that they're worried about fertility. Mm-hmm. And there was a very nice conglomeration of trials that were presented that showed that suppressing women's ovaries or putting them to sleep during chemotherapy may enhance their chances of becoming pregnant later and preserving their ovarian function. And I think that gives people hope because a lot of times when we see a young woman with breast cancer, we're in somewhat of a fast-paced situation where we really want to get started on therapy very quickly with something like chemotherapy. And chemotherapy has side effects like premature ovarian failure, infertility. And so while we ideally like to send them to a reproductive endocrinologist, have them save eggs or embryos, sometimes we don't have time for that, or it's cost prohibitive. So to be able to offer them a shot that puts their ovaries to sleep that may give them the hope of fertility later was really nice to see.
Does this deactivation, as it were, of the ovaries, does it wake itself back up, or does it have to be deactivated through a chemical process as well, or activated again through a chemical process?
That's a really good question. So that's why we give the shots, because it's reversible. It's reversible ovarian ablation. You
mentioned that some old things had been revisited. That being said, where do you see the future of breast cancer diagnosis and treatment in view of some of these things that you saw at the symposium?
So I think that we definitely need to make sure that women with estrogen receptor positive breast cancer stay on their anti-estrogen therapies. Some give them more aggressive estrogen therapy. But I think that we need to make sure that women who are diagnosed with breast cancer that have significant family histories or are young or have several subtypes of breast cancer, they definitely need genetic counseling and testing. But as far as the future, I think really personalizing therapy is becoming more and more important, making sure that women have access to clinical trials so they can take advantage of the new agents that are being developed, and also making sure that we support them with the toxicities of the therapies that happen.
There are some benefits, I'm sure, of being treated for breast cancer in the community setting. What are some of those benefits that you can tell us about?
I always think it's important for women to get cutting-edge care close to home. And many of the women and even male breast cancer patients that I see, they have very busy lives. For them to go an hour and a half, 2 hours in traffic to a quote-unquote major institution is a real disruption of their life. A lot of my patients will walk to our clinic and receive their therapy, or it's easier for their friends and family to support them. And I think that as long as there's cutting-edge care, I think the convenience and the personalization of community care, where everyone knows your name, is a real bonus when they're going through a really difficult time.
And being in a community setting, I guess friendships and other personal relationships are forged, which also lends support.
Oh, absolutely. Absolutely. I personally practice right outside of D.C. in Northern Virginia, a very metropolitan suburb. But it is very nice to be able to meet the people I treat, families and things like that at the grocery store or restaurant. And I think that it really fosters a sense of community. Additionally, sometimes I know the child's teachers of the women that I treat. So a lot of that helps. We, of course, maintain confidentiality, but it really helps to know the setting that the patients that I see in the clinic, what kind of lives they have outside of their office room that I see them in.
Where can we go online and get some more information and maybe view some of these treatment options and some of this new information that has been presented at the symposium?
So sabcs.org is the conference website. Additionally, there is a hashtag on Twitter, breast cancer social media, BCSM, and a lot of the new drugs, a lot of the new findings from the trials are very well outlined there.
Well, I appreciate you coming in, Dr. Neelima Dinduluri. Thank you, and I'm hoping we'll talk in the future.
Thank you for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of the program are available at hpr.fm and healthprofessionalradio.com.au. Subscribe to this podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.